Hi everyone. Today we are going to learn about a type of cancer known as leukemia. So, to begin, what is leukemia? Leukemia is a type of cancer that forms in blood-forming tissues of our skeletal system. It is characterized by uncontrollable growth of white blood cells, which grow within the bone marrow. But what do these cells do? White blood cells, also known as leukocytes, are involved in our body's immune response. There are two classes of leukocytes, granulocytes and agranulocytes. These classes can further be broken down into a few different categories. Granulocytes are primarily involved in killing off bacteria, the inflammatory response, and allergic reactions. Agranulocytes eat bacteria and cell waste, interact with other cells, and make and secrete antibodies, which are blood proteins that recognize foreign substances in the blood to be attacked. The other primary type of cells in our blood are red blood cells, or erythrocytes. These cells function to carry oxygen throughout the body. Their biconcave shape allows for easy loading and unloading of oxygen and carbon dioxide. They contain a protein called hemoglobin, which is made of iron and works to transport these gases. Ultimately, the uncontrollable growth of leukocytes causes an overabundance of these cells, and they wind up taking up too much space and replacing other blood cells. This decrease in the number of important cells found in the blood is the real danger of leukemia, because many bodily functions are impaired as a result. So, what causes this uncontrollable growth of white blood cells?
The exact causes of leukemia are unknown, but it is commonly believed that people can develop this form of cancer as a result of unwanted DNA changes or mutations in certain blood cells. These mutations can occur because of genetic or environmental factors. Genetic factors are factors that can be explained by your family history and whether members of your family may have had the same condition. Environmental factors are often due to exposure to carcinogens, or factors that cause a physical change in your body because of the area around you. Can anyone get leukemia? Some individuals are at a greater risk for developing leukemia than others. Men are more commonly diagnosed than women, as are people 65 years of age or older. Some risk factors include old age, long-term exposure to radiation or carcinogenic chemicals, smoking, family history, or comorbidity with certain blood disorders or congenital syndromes. What are some symptoms of leukemia?
Patients with leukemia may experience a few different symptoms, including feeling tired and weak, loss of appetite, which can lead to weight loss, frequent infections, and easy bruising or bleeding. What causes these symptoms? Lowered red blood cell count, as a result of white blood cells taking up too much space, can cause both tiredness and weakness. Red blood cells carry oxygen, and so with less oxygen being delivered, the body must work harder to deal with this, leading to patients feeling tired or weak. Patients with leukemia are prone to bruising and bleeding. This is because their overabundance of white blood cells leaves less space in the blood for platelets. Platelets are cell fragments that help with plugging up blood vessels and clotting the blood when necessary. So when platelet levels are low, blood is sometimes not clotted when it needs to be, resulting in more bruising and uncontrollable bleeding. Although patients with leukemia have very high white blood cell counts, these white blood cells are not fully developed, so they do not fight germs. This results in a weakened immune system and low red blood cell count, meaning these patients are more likely to have infections. Now that we know about the symptoms and complications of leukemia, we should understand how it is diagnosed.
Leukemia can be diagnosed a few different ways. Most often, doctors will order blood or bone marrow tests to look for the presence of this cancer. Blood tests of patients with leukemia will show low levels of red blood cells, hemoglobin, and platelets, and very high levels of white blood cells. A bone marrow test is used to look for the presence of leukemia cells. Doctors can also conduct a physical examination, which may indicate that someone has leukemia. In a physical exam, they will look for signs of pale skin from anemia, swelling of lymph nodes, or enlargement of the liver or spleen. Anemia is a condition marked by red blood cell deficiency, and so pale skin as a result of this condition may indicate the presence of leukemia. Lymph nodes are involved in the body's immune response, so swelling may indicate that the body is currently fighting an infection of some kind. Enlargement of the liver or spleen may also be an indicator because these organs function to filter this blood and recycle red blood cells. In patients with leukemia, there is an overproduction of some cells, and so these organs can become clogged up with abnormal cells and thus become physically enlarged. We now know that leukemia is a dangerous form of cancer that attacks our immune system and inhibits functioning by reducing our blood cell formation. But how prominent is this condition? Leukemia is the most common form of cancer diagnosed in children. It also accounts for 2.5% of overall cancer incidence in the United States and 3.5% of deaths from cancer in the U.S. annually. Although this may seem hopeless, there are treatment options. Patients with leukemia may undergo chemotherapy, biological therapy, targeted therapy, radiation therapy, or stem cell transplant. Treatment for leukemia depends on many factors, including age, overall health, and the type of leukemia the patient is diagnosed with. What exactly are these treatments?
Chemotherapy is the primary form of treatment for patients with leukemia. It uses chemicals to kill the infected cells directly. These chemical drugs can be single or combination drugs and can come in the form of a pill or be directly injected into the vein as a liquid. Immunotherapy is another form of treatment that helps the immune system fight cancer by using substances made from living organisms, such as white blood cells, tissues, and the lymph system. Targeted therapy is a type of therapy that uses drugs to attack specific parts of cancer cells. The therapy works by blocking the ability of leukemia cells to multiply and divide, cutting off the blood supply for these cells, or killing the cells directly.
Radiation therapy is another form of leukemia treatment which uses high-energy radiation in order to kill the cancerous cells. The patient can receive the radiation either to the entire body or to a specific location. It is typically not part of the main treatment for patients with leukemia and is only used in certain situations where other forms of treatment are not feasible. Finally, stem cell transplants can be used to restore healthy bone marrow in patients. These cells stimulate new bone marrow growth and can help to restore the immune system of people with leukemia. In this treatment, the patients first receive high doses of chemotherapy to destroy the cancer cells in the bone marrow. Then, the healthy stem cells are pumped into the veins to grow into healthy new blood cells.
Overall, leukemia is a dangerous form of cancer that attacks our body's ways of defending itself. But there are ways to treat the disease and handle complications, and a good team of doctors can make it all the difference. We hope you learned a lot about leukemia and the importance of white blood cells. Thanks for watching.